Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma, Optimal Health Associates. It's March 13th. It's about 6:15 Central Time. I'm sure many of you saw the president's comments today. I just want to review those and what I think is going to happen next. Those of you who've actually watched what I've put out over the last 5 to 6 weeks really wouldn't have found what the president finally did today as a surprise. Unfortunately, as I've said all along, I was hoping I was going to be incorrect, but pretty much everything I thought was going to happen has happened and will continue to happen. So I want to go over the president's comments today because there's a lot of meaning in what he said, but it's important you understand what they were telling you without saying it in a completely obvious way. The first thing to realize is the federal government is ratcheting up its care. I was very excited about that. I had a lot of frustrations this week with the Oklahoma State Health Department. The Department of Epidemiology was clearly not up to snuff, unfortunately. Not so much their fault, but again, sort of their fault because they're professionals. But ultimately, I think today was a good move by the United States federal government because they finally acknowledged fully that they have to do something. So the first thing that President Trump told us was CMS rules and things related to medical licensure and hospital licensure were going to be changed and or prior rules exempted. What does that really mean? In English, it means hospitals can now admit as many people as they can possibly hold. They can use beds that were quote unquote outpatient beds, meaning people couldn't stay overnight per se. Those can be used as inpatient beds. They can put people in hallways. They can keep as many people as humanly possible in a hospital. The second part is the licensure thing. It means basically that doctors, nurses, respiratory techs, radiology techs, if you're licensed in one place, you're going to probably be allowed to work in any place where there's a need, so you can cross state lines. Those are huge changes. And why are those changes in place? They're in place because the federal government now expects there to be a full pandemic affecting millions and millions of Americans, with tens of thousands getting very ill. So that's what you need to realize. That's what it means. Number two, the Trump administration talked about testing and how they're finally going to have testing. Testing has been a total failure. Tony Fauci from the NIH, who they keep on trotting out, went over that a little bit today. Keep in mind, for me, every time I see him, I'm completely annoyed because he was the main person who diminished and dismissed COVID-19 through January and February, but now he's suddenly on board. But I think that, be that as it may, they are increasing their testing. Why are they increasing the testing? Well, one, because they need to, because in order to figure out how many people have it and do appropriate containment or slowing, you actually have to have positive tests. You can't have positive tests if there's no testing. So really, what's the goal of the testing? The goal of the testing is to make sure we get to 10 to 20,000 positives as soon as possible. Once there's 10 to 20,000 positives, the government can then do the next step, which is close down the country for 4 to 8 weeks. So that's what you need to get ready for. The third thing that Trump said that follows this was that he's activated the National Guard. You can't just do a lockdown on the country. You have to get the systems in place. So activating the National Guard, which is going to take about 7 to 10 days throughout the country to get it ready to enforce quarantines, is also going to start now too. Not the quarantine, but you have to get a system in place. And then the fourth thing Trump said is they're going to fill the national emergency oil reserve. One, it's a great plan because oil's cheap, but there's a second part of that. If this virus continues the way it's going to, it is probably going to affect world trade, and there will be diminished oil imports from overseas. And while we are not energy independent, but we're energy successful onto ourselves, having a lot more of our own oil stored if there's a diminishment of foreign oil coming in because of the virus, which is highly likely that world trade is going to be affected drastically in the next 4 to 8 weeks. We won't be in pain from an oil shortage in the United States. So basically, Trump laid out very clearly what the government is anticipating and what they're doing to handle it. Some of the final things he brought up with bringing the home health people out in CVS and Walgreens and incorporating all these groups is showing, one, we have industry behind the plan, and two, older people who are the ones who are going to be most affected with this illness, but again, not the only ones, which I'll circle back to, are going to need a lot of support. And he wants them to know that they're going to mobilize the support systems that are available to our senior members of our society and try to help them as best we can. But I do want to get back to a very important point with COVID-19. COVID-19 has a predominant tendency to affect people who are older. So I'm 55, I'm the beginning of the cutoff. It's going to start going up higher and higher and higher with people older than me. But it is going to affect tens of thousands of people between 35 and 55. People in that age group are going to get very ill, and they are also going to die from the disease, unfortunately. So we have to plan, again, prevention. The data on diabetes, the data on hypertension, the data on lung disease isn't specific to age. Yes, it's worse if you're older and you have one of those, but it's still a bad deal if you're younger. So you have to think prevention. Prevention requires taking a multivitamin now to build up your immune system and get on 50 milligrams of zinc. You need to do it. If you can't find it, call around. It is out there. I can't emphasize enough that prevention still matters in addition to washing your hands and giving social distance and wearing a mask. Most people are still going to get the virus. So we want you to be able to fight through it and not be as affected by it. So I want everyone to really cognate on trying to do some building of the immune system. On a final kind of summary thing, I think that we're in good shape as a country. We're finally mobilizing. When Americans turn their hearts and minds to something, we're incredibly successful, and we're going to get through this. I'm very impressed with the president's plan today, and I'm meaning that in a truly nonpartisan way. This is what we needed to have happen, and it is. The Congress is passing the support packages necessary to help economically, so I think we can be optimistic. Sunday, when I do my next post, I'm going to go over some science and some strategies for treatment if you get sick to ask your doctor about. There are definitely some papers out on how to treat COVID that are non-traditional, and as someone who's spent their life in the cutting edge of medicine, which sounds hokey, but in my case it's somewhat true, always pushing the envelope for best science for my patients. There are some things we'll go over on Sunday. Hang in there. Take care. Good night.